Hey everyone, welcome to part 3 of our 4-part series on Dance Your Heart Out. If you recall, our first part was all about your heart and your lungs, cardiopulmonary, what you can do, how you can move to keep yourself moving, healthy, strong, and staying alive. Our second part was all about joint health. That's right, feeling that arthritis and what you could do to start making yourself feel better. Well, today we're going to be talking about joints, but one specific type of joint particularly, which is going to be your spine. That's right, the bony housing all around your spinal cord, the spinal cord that gives nerves to every part of your body so you can feel, so you can move. Very, very important stuff. And as always, we have Caryn Cooper from Dance to Wellness, and you have myself, Dr. Daniel Davids, PT from the Traveling Physical Therapist. Welcome to part 3 of 4, Dance Your Heart Out, Spinal Health. Hey everyone, my name is Dr. Daniel Davids. I'm a physical therapist and I run the Traveling Physical Therapist. We provide Medicare covered in-home physical therapy throughout Long Island. And we have a special thing that we're going to be doing today where we're going to be focusing on education, equipment, and services in the home of seniors. And specifically today, we have something we're going to be talking about when it comes to spinal health. And we have some exercises that are going to absolutely help you move better. And we have a very, very special guest. Let me see, where is she? Caryn Cooper, where are you?
I'm right here. Hey everyone, my name is Caryn and I'm the founding director of Dance to Wellness. Here we focus on doing fitness and nutrition programs for older adults and seniors. So today we're going to be talking about the spine. Oh yeah. So as it was mentioned before, the spine is very important to our nervous system. It basically serves as the information highway between the brain, and the rest of our body, rest of the body. So there are about 33 bones called vertebrae that make up our spine. And the spine is divided up into 5 main parts. So starting at the top, there is the cervical spine. This makes up our neck. Then we have the thoracic spine that makes up our upper and middle back area. We have our lumbar spine, also known as the lower back area. And then we have the sacral and coccyx, which makes up our tailbone. So the spine does have some natural curves to it. So if I turn to the side, you'll see that I do have these curves here. So coming all the way down. So those are healthy curves. However, when and if those curves become more exaggerated or bigger, that can lead to some pain and discomfort. So some examples of that can be hyperlodorsis, which is an exaggerated curve of the lumbar spine here. And so this is my neutral spine here. So I have my natural curve, but if it's hyper extended and curved, you'll see that my pelvis is tilted and it really leads to some lower back pain, if you will. Then we also have hyperkyphosis, which is an exaggerated curve of the thoracic spine, causing a hunchback. And basically, that's just a lot of rounding of the shoulders. So if you spend a lot of time slouching, whether you're hunched over your computer or your phone or your tablet, that can lead to some excessive slouching that we want to avoid. And then there's also another common exaggerated curve of the spine is scoliosis. And so that's more of like a sideways curve of the spine. And so your spine can kind of have an S shape. And so that can lead to you leaning more towards one side or the other. And now I'm going to turn it back over to Daniel.
Hey everyone, so it's very common when talking about back pain or spines in general that we talk about back pain. It almost goes hand in hand. Like if you want to know about the spine, you have to know about what hurts it. And one of the most common things that I hear as a physical therapist all the time are people saying that I have a herniated disc or I have a slipped disc. And let me tell you something, it's very possible, but there's actually a lot of studies that show that if you take a healthy person, someone like myself, someone like Caryn, who has no back pain, and we had an MRI, it would actually show that we also have herniated discs. Very strange. In fact, they did a test of 200 plus people, and they found that 80% of people who did not have back pain had herniated discs. So, can you have a herniated disc? Of course. Can it be painful? Absolutely. Does it have to be? No, no, no. And there's other information. Herniated discs are really something that affects people under 50 years old. Because as you get to be 50, 55, moving on to 60, those joints, those joint spaces, the discs, actually, they shrink and they shrivel up. They don't really herniate meaning to move. They don't really herniate out of the way. They kind of just dry up. Think about a sponge. A wet sponge, you can push. A dry sponge, well, that's not really you can't really do much with that. In fact, because it's drying out, it's actually, your whole body gets a little shorter. I'm sure that you've noticed in the past 20 years, you've probably got a little bit shorter, not a little bit taller. That's because your discs are shrinking. So what happens when those discs shrink? Well, then you have something that's very possibly called spinal stenosis. Spinal stenosis is when the area where the nerve comes out of your spine is actually getting smaller, right? That's what stenosis means. If you're talking about in your heart, it's about the arteries getting smaller. If you're talking about in your spine, you're talking about the area where the nerves come out of getting smaller. Now, what does that mean? Well, it means that when your spine, when that hole is getting smaller, standing up makes that hole even smaller, and that's a little bit harder. So it's a little bit more comfortable to kind of bend forward in that kyphotic posture. That was the vocabulary word that Caryn used. And that kyphosis posture, that kyphotic posture, so you're bending forward. In fact, you can see someone who has spinal stenosis very quickly if you go to a grocery store. If you see someone who's leaning on their grocery cart like this and pushing it, that's called a positive shopping cart sign. And it's one of the things that we as physical therapists and physicians notice right away. If someone's doing that, they very likely have spinal stenosis. So if it gets better with bending down and worse with standing up or extending your spine, there's certain exercises that are going to help you, like bending exercises, obviously. However, you have to be careful, because if you have osteoporosis or the brittling of bones, if your bones are getting more brittle, bending forward could actually cause a fracture to happen, which, if you think back pain because stenosis is bad, imagine having a fracture, a broken bone, much, much more painful. So it's normal to have these changes, but there's a lot that you can do to start feeling better. But how do you know when to go reach out for a doctor or a physical therapist or some type of professional help? Well, if you start noticing bowel and bladder changes, you're not using the bathroom as much, using the bathroom a lot more, you're not able to hold it, that could be an emergency where you have to go to the emergency room. Other things, if you notice that you're getting more clumsy, if you feel like you're losing some sensation in your foot, that could be something where you'd want to go, you know what, I should get that checked out. So you can learn all this information and more. I actually produced a book here called The Top 10 Back Pain Secrets Revealed that you can get on Amazon. We keep it as low as possible. I think it's like $3 and change. We're giving it, it's as close to free as we can get. I don't make a penny on these. So you can go check out this book. I'm going to put a link down below so you can get it. But you have all that information, and there's more. There's so much more that's out there. And Caryn's going to help us out right now by showing us some exercises that will absolutely help your back feel better. Caryn?
Yeah, so with all of that said, it's really important to maintain, to the best of our ability, good posture, because this can help decrease your risk of different spinal injuries and other spine-related health conditions, such as what we mentioned earlier. So good posture contains you sitting or standing nice and tall, chest open, nice and wide. And if you imagine that you're a marionette puppet, you can imagine that there's a piece of string on your head. And so if I turn to the side here and I have this piece of string pulling me up, it lengthens my spine. Oh yeah. So there are some different exercises and stretches that you can do that can help relieve some back pains that you may be having. Of course, before jumping into any exercise program, you do want to check in with your physician or get a consultation from a physical therapist, such as the traveling physical therapist. And yeah, and so I'm just going to make my way over to my mat here, because some of these exercises that I'm going to do are very common in a yoga or a Pilates class. Let's get started. So the first one that we're going to look at and talk about is cat camel. And so this is good for relieving lower back pain. And so if you're getting on your mat or a towel or just a surface that's a little gentle on your knees here, you're going to be in tabletop position. So you want to make sure that everything is nice and aligned. So hips over the knees, shoulders over your wrists. And so what you're going to do, if you have seen a cat, before doing a nice little stretch, you'll notice that they're just really lifting up their chest, having their gaze up at the ceiling, having a nice curve of the spine. And then on the opposite, you're doing a camel. So a camel has a camel's hump. And so that's what we're going to do with our back. So we're curving the spine, bringing the belly up to the spine, and looking at our belly button. And again, gazing up, chest open, looking up at the ceiling, and coming into a nice curve, looking at the belly button, coming to a nice curve of the spine. And again, you can see Daniel doing the modified versions here. And then another exercise that we're going to do is called bird dog. And so essentially, again, we're going to be in tabletop position again. But now, I'm working your brain a little bit here because we're doing some opposition movements here. So what you're going to do, starting off in tabletop position, I'm going to bring one arm in front of me, but I'm going to have the opposite leg up. And then I'm going to switch and have the other arm and the other leg. And so, like I said, we're doing opposition. So opposite arm and leg are moving. And this is good just in terms of maintaining and making sure that you're moving and grooving in your neutral spine position. So we're not arching our back, we're not hunching over. To do this properly, you really want to make sure that you're in neutral spine. So again, opposite arm and leg. You can see Daniel doing the modified versions. And you're just doing opposite arm and leg, opposite arm and leg. And for our last exercise demo, I'm actually going to stand up for this one. We're just going to do a simple chest opener. And so for this one, this is good about helping to build and have muscles to support having an open chest. Because a lot of times when we start having poor posture, it's because our shoulders are rounded and we're hunched over. And so we want to have the opposite. So we want to make sure that our chest is open for good posture. And so for our chest opener exercise, turning here, you can see my arms are out to the side, but I'm just going to turn to the side so you can see what I'm doing here. So first, we're just going to come into a nice rounded position. So see how there's a nice curve of my spine here. And now I'm going to stand up straight, bringing my arms to my side, and then gently bringing them behind my body here. And so in this position, it's forcing me to open my chest nice and wide. And so this is what it looks like from the front here. So see how my arms are behind my body here. So again, you can relax and come into a nice curve of the spine. And then open up, bring in the hands behind your body, making sure the chest is open, nice and wide. And those are some simple exercises that you can do from home. Daniel, turn it back to you.
I feel excellent, Caryn. Those are some great exercises. We had a great time, and I feel like you did a great job explaining both about moving flexibility with the spine and also stabilizing, like not moving. And you did exercise for both those, and I think that's great. I think you did a very comprehensive job, and I think if you're following this at home, you're going to have a really great time. If you could follow these exercises, in fact, our entire series, This is our third of our 4-part series, which means, unfortunately, we only have one more to this. But that's okay, because you can watch these over and over and over again. But if you don't want to wait, then you could do right now. You can call or you can reach out to Miss Caryn Cooper by reaching her online. Caryn, why don't you give your website again?
Sure. So you can find me online on my website at dancetowellness.org. You can also find me on social media, and you can find me on Facebook at Dance to Wellness, and also on Pinterest at Dance to Wellness.
That's right. And if you have any questions about your spine regarding physical therapy, you can always reach out to us at www.thetravelingpt.com, or you can give us a call at 646-733-4737. And as I mentioned before, there's going to be a link in the description, but on our website, we have a link where you can go buy this book, The Top 10 Back Pain Secrets Revealed. It's actually a really fun book, a very fun book to write, and I've got a lot of positive feedback. Definitely want to pick one of these up for $3 and change. All right, so thank you, Caryn. As always, you've been fantastic. And for everyone who's been here watching and doing the exercise with us, we are excited for our final part of our 4-part series, Dance Your Heart Out. Caryn Cooper from Dance to Wellness. I'm Dr. Daniel Davis, PT from the Traveling Physical Therapist, and we'll see you next time. Take care.
Bye.
Great.